Hi, my name is Erin Hardy, and today I'm going to be sharing with you about information about panic disorder. I will share who is affected, what causes panic disorders, the risk factors, what the symptoms are, how this can be treated, and if it's not treated accurately, what will happen. The information I got my information from MayoClinic.com, National Institution of Mental Health, IPI.org, and MedicineNet.com. I'm sure many of you have heard the term of a panic attack. A lot of the times the term is used very lightly, but in fact many people actually suffer from this condition around the United States. According to the National Institution of Mental Health, a panic disorder is characterized by a fear of disaster, of losing control, and even when there is no danger around. Many times a person that experiences a panic attack may become discouraged because they are not able to carry out daily activities like normal Americans. This often begins in the late teens or early childhood. More women than men are affected by panic attacks. One in about every 75 people are diagnosed with a panic disorder. Like I said before, studies have shown that women are more affected, and they have shown to be more 2 times the number of cases than men. For women, they are mainly diagnosed with it between the ages of 18 and 24. The exact cause of panic attack is still unknown, but there are some factors that have been associated with it, with the disorder, which include genetics, major stress management, or major stress temperament, and certain changes in the way the parts of your brain functions. The duration of a panic attack can vary greatly. A panic attack will usually last for about more than 10 minutes. And after they have one, they'll usually continue to have more. Usually the panic attack will take place while you are asleep, which is also called nocturnal panic attack, which occurs less often when it does during the day. But for those who are affected by it while sleeping, usually have more respiratory stress. There are many risk factors that increase the risk of having a panic attack. If you are stressed out, the chances of having a panic attack is a lot higher. Also, having a dramatic change in your life, things such as losing a friend or a family member, to even having a baby. Another factor is if you grew up with a rough childhood, whether you were physically or sexually abused, more than likely this will trigger an attack. There are many symptoms associated with panic attacks. They typically begin without any warning and can take place at any time during the day, which can be quite dangerous if you are driving a car or operating a heavy machine. Some examples of symptoms include sense of impending doom or danger, shortness of breath, hyperventilation, nausea, chest pain, faintness, fear of loss of control or death, and even trouble swallowing. Panic disorders is a very serious and unpredictable within which needs to be taken very seriously, and someone who experiences a panic attack must seek medical attention as soon as possible. There are many different treatments for panic disorders. The medications that are prescribed are antidepressants or anti-anxiety drugs. This will reduce the frequency of the person having a panic attack. Studies have also shown that the psychotherapy really helps. Psychotherapy is what examines the scary thoughts, feelings, and behaviors. Often they will also expose you to your phobia, but they will have you in a safe environment while doing so. Other treatment that could help with this disorder include making a treatment plan and sticking to it, joining a support group from your friends and family, avoiding recreational drugs, practicing stress management, getting physically active, and getting plenty of sleep. The simple steps could help you from having a panic disorder. If a panic disorder is left untreated, it can lead to complications. According to myclinical.com, complications include development of phobias, problems at work or school, depression, higher risk of suicide, alcohol and substance abuse, and even financial problems. It is important to treat the attacks before it gets out of hand. My visual aid, this is a visual aid that I have, and it's just talking about the panic disorder and all the symptoms it has, things such as constant worry, excessive repetitive thoughts. Overall, panic attacks can affect anyone at any time. In my speech, I talked about who is affected by panic disorders. We found that women have more panic attacks more than men. I also talked about what causes a panic attack, which could be multiple things, such as losing a friend or even gaining a new family member. I also discussed the risk of panic disorders and how you should search for help when you have a panic attack. What the symptoms of a panic attack is like losing your breath. And the last thing I discussed is how to treat a panic attack. You can do so by seeking therapy and reaching out for help. I hope that you have learned something from my speech about panic disorders and have a little bit more information on it.